Hello, my name is Amir Aran, MD. I'm the Chief of Hand Surgery at Kaplan Medical Center, and today we'll be talking about thumb CMC1 osteoarthritis or basal joint arthritis. First, a disclaimer. This is not medical advice, and hence, if you are seeking medical advice or need treatment, please go to your local caregiver, be it a physician or anyone else. And now let's go back to our topic, CMC1 osteoarthritis. This is your carpometacarpal joint. It is the joint between the first metacarpal and the trapezium down here. If you look at the joint, you will see that it is a saddle joint. A saddle joint is built for movement in only 2 dimensions. Whereas in reality, what we are doing today, we use this joint in order to do opposition of the thumb and move the thumb in 3 dimensions. Meaning we're kind of like using the thumb as you would use a saddle during a rodeo. This causes arthritic changes at the base of the thumb. The basal joint arthritis or base of the thumb arthritis is the second most common site of arthritis in the body, only following the knees. The reason is what I just claimed, the fact it is such a small joint. It is very common in women, of course, and it is also the movement which is done in several dimensions. Initial treatment of this ailment is usually conservative. In conservative cases, what we usually do is we suggest you use a splint. You can apply cream locally, take non-steroidal anti-inflammatory drugs, take some supplements like glucosamine and chondroitin, and in these cases, you can also use paraffin baths and other conservative choices. What you usually feel is pain right here at the base of the thumb. You might have a shoulder sign, which is subluxation of the joint, and you'll see that the joint kind of came out of where it was. You will have local tenderness when pressure is applied over the joint and when it is compressed. Basal joint arthritis is usually treated conservatively initially, and later on, if this does not suffice, we can go on to performing surgeries. A surgery might be a trapezectomy with or without tendon replacement, or you can replace the joint completely all in itself. Before doing this, you might opt to get an injection locally, which might be steroids or some kind of blood derivative injected into the joint, which might also help. We can also use arthroscopy in this case, hence trying to fix the joint with arthroscopy, either cleaning it out or putting in a filler. But when you have a bigger surgery, this would mean a longer rehabilitation, meaning that in some cases, this might take even 5 to 6 weeks in order to heal from such a surgery. Basal joint arthritis is the second most common arthritis in the human body, and it is also very painful, and it causes a lot of pain and disability in some cases. Go to your local doctor, specialist, and get it treated. Thank you very much. I am Amir Aran, MD, hand surgeon, microsurgeon, Kaplan Medical Center. Thank you.